This week marks 6 months since the World Health Organization declared the coronavirus a global pandemic. Fast forward to September, and the death toll in the United States continues to climb. So how is the world's richest nation doing in its fight against COVID-19? Hello, I'm Mike Walter, sitting in for Anna Naidu, and this is The Heat. Another grim milestone is at hand for the United States as it crosses 190,000 coronavirus deaths. President Trump has been criticized for not doing enough, but the White House is pushing back, saying the administration has done everything to protect the American people. Now, Trump's response to the coronavirus is again being called into question, with the release of audio tapes of interviews he did with renowned journalist Bob Woodward for his latest book, Rage. Obtained by CNN and other news outlets, President Trump goes on the record back in early February, describing the virus as highly contagious and deadly. In a clip from March, he explains to Woodward why he held back true assessments of the disease from the American public. Let's take a listen.
Because it's clear just from what's on the public record that you went through a pivot on this to, oh my God, the gravity is almost inexplicable and unexplainable.
Well, I think, Bob, really, to be honest with you,
sure, I want you to.
I wanted to always play it down. I still like playing it down.
Yes,
because I don't want to create a panic.
Lots to unpack here. I want to bring in our panel. Joining us from New York, Dr. William Haseltine is Chair and President of Access Health International. From Iowa, Dr. Stanley Perlman is a professor of microbiology, immunology, and pediatrics at the University of Iowa. Joining us from Washington, John Tamny is editor of Real Clear Markets, and also here in D.C., Joseph Williams is a senior news editor at U.S. News and World Report, and I want to welcome all of you to the show. Joe, why don't I start with you? He says, to be honest with you, I wanted to always play it down. He's saying it's deadly, it's dangerous to Woodward, and yet to the public, for at least 32 times, he's going out saying this thing's going to disappear. It's simply going to go away. Talk to me about this. Give me your take on all of this.
Well, it's stunning, which is something that we say fairly often with this administration. And one of the questions that it kind of begs is, was he lying then or is he lying now? Because clearly almost 200,000 people have died because of this one pivot point where he chose to be a cheerleader instead of getting into the game as the quarterback. Now, it's going to cause some political fallout. It already has. He's basically handed Joe Biden a cudgel to beat him upside the head with going forward towards the election. Biden's already taking advantage, saying that the president did not perform his due diligence and was basically asleep at the switch when this pandemic swept through. He also is, Trump is underwater significantly with the American people in his handling of the virus. There's a 15-point spread, and he's almost at 60% of people who don't believe that he's handled this crisis very well. And that's not only underwater, it's heading towards the ocean floor. So it's going to be a big political problem for President Trump going ahead. And basically, this is an administration that has defied political gravity at every turn. But I think with the number of people who have died, the number of people who haven't been able to embrace a loved one or hold a proper funeral, I think it's going to resonate.
And you mentioned Joe Biden. He was in Michigan today. Let's listen to a little bit of what he had to say.
We just learned from the Washington Post columnist Bob Woodward that the President of the United States has admitted on tape in February he knew about COVID-19 that had passed through the air. He knew how deadly it was. It was much more deadly than the flu. He knew and purposely played it down. Worse, he lied to the American people. He knowingly and willingly lied about the threat it posed to the country for months.
Joseph, it seems like a barrage, though, coming at voters. I mean, it was just last week we were talking about the Atlantic article where anonymous sources said he was calling veterans suckers, losers. Now this. Does it really have much of an impact, or is people starting to tune this stuff out, do you think?
I'm not sure that they're tuning this stuff out. I mean, the troops disparaging generals and the troops, yes, that's over there. But COVID kind of hits home. We've had people, loved ones, it's hard to find somebody who hasn't had a loved one who has either been sickened by the disease or died from it. Where schools are closed because of it, or many schools are having distance learning because of it. We're working from home because of it, and many people have lost jobs because of it. And so therefore, I think this is a lot more of a direct effect. What he said and what he did in terms of the pandemic has had a direct impact on a lot of people. You're absolutely right. It's one thing after another with this administration, but I think this is one of those times where inaction has really hit home and has changed the way we live. But for that moment of indecision, we might be in a very different place right now.
And William, today the President of the United States made a brief appearance at the White House and tried to put his own spin on it. Let's listen to what he had to say.
We had to show calm. The last thing we can show is panic or excitement or fear or anything else. We had to take care of the situation we were given.
Are the choices really that stark? You don't want to show panic rather than level with the people?
No, they're not. And while you're reassuring people that you're doing something, you're actually doing something. And what happened is he did nothing. And we have suffered. I personally estimate that of the 190,000 people who have died, about 180,000 of them have died because of lack of rational action. If you look around the world and the knowledge we had, and he had then, it is very clear what you had to do. The Chinese were doing it. In fact, the information that the president got, he told Bob Woodward, came from President Xi himself directly, person to person in a conversation. And the actions that the Chinese did brought the infection down to close to zero, and it has remained there ever since. They had a 2-month problem, 2.5 months problem essentially solved without a vaccine and without a drug. I think we can still do the same thing. We have to do it differently because things are way out of hand. We have 50,000 people a day being infected, 40 to 50,000 people. We can still put this genie back in the bottle, but we need somebody who understands the problem, understands how government works, understands what the tools available are, and doesn't give us pie in the sky like we're going to have a vaccine by election day, and that's going to save everybody. That isn't the way it works. You do it by hard, consistent public health processes, and that's all it takes to put this genie back in its bottle. And we can do it, but I don't see anybody doing it, and it's a deep frustration to all of us in public health and all of us who know what could have been done to save those lives. And you know, when you talk about people who know people who have died, I know people who have died. I know people who were in body bags lying in the street a few blocks away from me, and they were some of my friends in those body bags. That is what I know.
Pretty powerful stuff there. Stanley, you know, when you look at this campaign, though, it's really interesting. Everything seems to pivot around the coronavirus. You have one candidate who doesn't want to wear a mask, is very vocal about it. The other day, asked by a reporter a question, he asked him to take the mask off, couldn't hear him, he was too muffled. He makes these campaign appearances where you don't see a lot of masks. And then you have another candidate who is going out with a mask, Joe Biden, and is trying to have social distancing. Everything seems so politicized, even down to a vaccine now, with a lot of people concerned about it being rushed through. And today, the head of Health and Human Services was on Capitol Hill talking about that. Let's listen to what he had to say.
I can't say strongly enough that the decisions about how this vaccine is going to be evaluated and assessed is going to be based on science. And I know I speak for my colleagues in the government and certainly for the scientific community broadly, that that can be the only basis upon which this decision is made. Otherwise, the public would not be expected to trust us.
But that trust issue is out there. Just last month, NPR and PBS did a poll. A third of the people polled said they are simply not going to take the vaccine when it comes out. Talk to me about your concerns there.
Yeah, so this is clearly part of the same problem. I think that people will want a vaccine that's both safe and works well, and we don't know either one yet for any of these vaccines. They're all being rushed through phase 2 and phase 3 trials. I think if people see that they're working well and there's not side effects and not adverse effects, then they'll be more keen on taking it, because if we realize it works, then this is one way to get the herd immunity that we need at this point to start eliminating the pandemic. So I think that's And the concern, it's a huge concern that people won't take the vaccine. Even some of the people I know in healthcare fields are very wary of taking the vaccines. They'll be the first ones to be offered the vaccine because they're most vulnerable, and we don't want them spreading the infection to others. But even there's a lot of skepticism and worry that a healthy person taking an unknown vaccine, they want to know that it works and it's not going to cause any worse problems.
So let me get your thoughts on this, Stanley, about AstraZeneca and halting their trials. Does that hurt or help in that regard?
Yeah, so I think that this kind of occasional event occurs during vaccine trials. We don't know if it's even vaccine related. We just know something occurred. And I think that it's part of all the publicity around the vaccines that it's even noticeable. If we don't want any vaccine, certainly don't want this process or this side effect to occur in large numbers of people. But as I said, we don't even know it's from the vaccine, and there's only one case. So yes, of course, it makes people more worried about it, but that's partly because there's so much publicity rather than it being something that's really extraordinary in a vaccine trial.
And William, that's a good point. In these trials, there are bumps along the way. That's part of the process. That's why it takes so long, right?
Yes, that's true, but this is actually the second time this very rare event has occurred. It occurred in the phase 1 trial. It's called transverse myelitis. It now has happened again. It puts the whole question of the adenovirus vector vaccines approved in China, approved in Russia. About a third of the vaccine candidates, or 20% anyway, are using these adenovirus vectors. But it's an effect that can occur with viruses. Adenoviruses are famous for being used in gene therapy on neural tissue. There are over 100 references in the literature of the ability to use the adenoviruses of various types to infect neural tissue. It's not actually surprising if you give a giant bolus of adenovirus that it might affect the spinal column, which it does, and it paralyzes people. And if you get it in 1 out of 20 people in a phase 1 trial, and now in early phase 3 trials, you get it again, I'm not surprised that they stopped the trial. And I wouldn't be surprised if everybody using adenovirus vectors, including the Russians and the Chinese, took a big, hard second look. Let's take a look back in history. There's one very famous case where an adenovirus vector caused a whole field to crash. And that's Jesse Gelsinger, who was killed by an inappropriately used adenovirus vector. And that stopped gene therapy for about 20 years. This could easily stop adenovirus vector vaccines for a long time to come, if not forever. This is not a transient, simple thing. Now, it may be that this had nothing to do in 2 separate cases with a virus, but you are using a neurotropic virus, and this is a neurological abnormality, which is quite rare. 1,400 cases per year in the entire world.
Wow.
And now 2 with 1 vaccine is pretty suspicious.
Wow. John, let's bring you into the conversation, because the other piece of all of this is the economy, and we're still seeing problems there. NPR, the Robert Wood Johnson Foundation, and Harvard's T.H. Chan School did a poll. They found that half or more in the 4 largest cities in the United States are suffering. Economically, they're really in a dire spot. Talk to us about the landscape out there.
Well, let's be clear that this is the greatest human rights tragedy of the 21st century, precisely because we fell for all the alarmism being expressed by some of the physicians on the show. You'd think from hearing them that there's blood on the streets everywhere and that people are dying left and right, but we knew back in January this virus wasn't terribly lethal, and how we knew that is it had been traveling through China for a couple of months by then. FedEx has a 900-person operation in Wuhan. All 907 of those tested. 4 of them were tested positive, 2 were false positives, none of them died. The greatest companies in the world are American. They've all got major exposure. Apple's the most valuable company in the world. It gets 1/5 of its iPhone sales in China. Does anyone seriously think that if it had been killing indiscriminately before the Chinese government did anything about it, that this wouldn't have affected U.S. shares, but U.S. shares were hitting all-time highs in January and February. So these physicians are talking so certainly about what this virus means when these same people in many instances got AIDS so wrong in the 1980s. Meanwhile, 285 million people, according to the New York Times, are rushing towards starvation around the world because the political class around the world decided to fight a virus with mass economic desperation. And I'll just add one other thing. I'm no fan of President Trump, but this notion that it's the president's job to fight a virus shows ignorance about the Constitution that it actually exceeds the president's own ignorance about our founding document.
William, I'll give you a chance to respond to what he just said.
He is so far out of reality that I'm not going to respond. It's just what he said is
please do.
And utter nonsense.
Stanley, do you want to take a stab at it?
I don't think I want to either.
Okay, well, we'll move on. There's no doubt, though, that people are hurting. Joseph, there's talk on Capitol Hill, Mitch McConnell moving forward with the Republican bill to try and address things. It's been called a skinny bill, although Chuck Schumer's calling it anemic, I think was his word, or emaciated, rather. Is there a chance that both parties can come to some sort of agreement to try and provide some type of bailout?
Well, it's looking like they're going to have to, but anything that they come together on is probably not going to be nearly as robust as what happened earlier in the year when they had $600 supplemental unemployment to people every week and a $1,200 one-time bonus check. That was real money that helped people get through these times. And if they pass something that's even skinny, it may be too little too late because evictions are already starting to happen. We are already having people struggling and lining up for food. I mean, it's not just happening around the world, it's happening in the U.S. as well. And, you know, the notion that a president is not responsible for solving a pandemic is just kind of ludicrous. I mean, he's the chief executive of the nation. This falls on his plate. We've had several pandemics in the United States that have been averted because presidents have taken action. And also the notion that there aren't bodies in the streets. Well, I have some friends in New York who would contradict that. And the notion that the president was trying to avoid panic, I mean, we'd contradict that too because ambulances screeching by your house every night for months on end, that's the very definition of panic when you have a virus that's happening and you don't know what's going on and you don't know how to solve it. At the very least, if President Trump is not, if we take it at face value that President Trump is not responsible for solving a pandemic, at least he is responsible for delivering the truth to the American people who can handle this. I mean, we've gone through 9/11, we've gone through Pearl Harbor. The American people deserve to have heard the truth, and we probably would have been in a much better situation than we are right now, clearly, I think.
John, what type of legislation should come from the Hill in terms of targeting some of these economic issues?
Well, why would you have legislation? It's somewhat of a non sequitur. Does anyone deny that, or was it fake news that the economy was in pretty good shape in February? And then suddenly it wasn't. It fell off a cliff. Well, that's generally what happens when politicians on the city, state, and national level put the proverbial boot on the economy and asphyxiate the ability of people to produce. And so why would you empower the same political class that did so much damage to do more damage? And, you know, I just asked the question, blood in the streets. For one, anecdote is not statistic. The fact that you know someone, you all sound like you're pretty old. But
we do have statistics, however. There are statistics there.
Okay, so did the New York Times...
And we're not talking just about people who died. We're talking about survivors who are permanently damaged, who are permanently crippled, who have lung problems. We're talking about the shutdown of the National Football League and the National Basketball Association.
Well,
we're talking about an economy that ran off the rails because the virus caused the problems. People couldn't work because they were getting sick. I don't really understand where you're coming with this. I mean, this is ludicrous.
Did the New York Times lie when it said 40% of the U.S. deaths took place in nursing homes? Is the CDC lying when it says...
That's a false equivalency right there.
You're talking about
what you're doing is you're suggesting that pre-existing conditions, either being old or being obese or having asthma or anything like that, you're suggesting that that was the death sentence when that is not true. What is the death sentence is the virus. If the virus had not come along, those people who were old and sick and obese and had asthma would still be alive. Except
They'd all
for the
still be
virus.
alive, and you know that. And so is the CDC lying when it says the hospitalization rate for those affected is 0.1%? Is the CDC lying when it says 94% of those died did have pre-existing conditions, which might at least suggest that some of those people were sadly in the position of dying in the first place?
I think you're using faulty logic
No, you
there.
think so.
No, you're
you think so,
faulty
but
logic.
again.
Okay, all right, John.
But your logic is correct.
Well, John, I think you made your point. William, I want to ask you about schools. Reopening schools, of course, has also been a lightning rod issue. Nearly 500,000 kids have been infected so far. And I see right behind your shoulder there, COVID back to school. Obviously, parents and students concerned about this. What's the answer?
The answer is to know what your relative risk is depending upon where you live and who is at your school. And so what we advise people to do is to know what the infection rate is in their local community. And it's available to know by zip code, it's available to know by county. And we tell you how to do that. If you're in a green zone, which is very few, but there are some, it's okay to go to school and you can be relaxed. It's like not worrying about going outside when it's a sunny day. But if it's yellow, you've got to have equipment. You've got to be prepared. You've got to wear masks. You have to do social distancing. You have to check to make sure the school is okay. And you have to find out where all the people in the school are and whether they're being tested and whether they're positive or not. And then if it's an orange zone, which unfortunately a lot of our country is today, or red zone where they're very, very high, you wouldn't think of sending your child into that kind of danger any more than you would send it into a hurricane or into a violent thunderstorm. You just wouldn't do that. And so those are very simple rules that we ask people to observe and to think about. And then we provide a whole series of other pieces of advice about how they can think about their education, how they can handle the child's anxieties, how they can handle learning disabilities. There's a whole series of techniques that are being developed to deal with this very unusual situation. Nobody likes the fact that it's dangerous to send your kid to school, but that is the fact that we have to look at what the facts are and try to protect our children as best we can. It is our job as parents, as grandparents, to do the best we can for our children and our grandchildren.
And Stanley, universities, colleges also becoming new clusters. What's the answer there?
Well, I think it's actually the same kind of thinking, because even getting back to some of the earlier points that were being made, I think where you have good leadership, some of the nuances that we're talking about come out. So at my university, there's not much testing. There may be a little more going on now, but there's not much testing. Students were told to come back. The classrooms are being designed in certain ways to try to minimize contacts and increase social distancing. But it never felt like there was a discussion among all the players in the community, either at the university level, the state level, or the national level, to think about what's the best way to do this. And I think that's when people talk about leadership, that's what I would want to see. We know that a lot of people in nursing homes died early on, people in long care facilities. We know that people in meat packing plants in my state died at very high levels and became sick at high levels. So these are clusters of people who we knew would be vulnerable. And if you have good leadership at all different levels, you have a discussion point. And you try to figure out, okay, how can we protect these people and not have the economy crash at the same time? And you don't do it by assuming that the economy won't crash. You don't do it by assuming that the economy will crash. You have a discussion, and there's been so little discussion at all these levels and how to do things. I think, to me, that's one of the biggest problems.
Talk to me about Iowa, because Iowa City now is seeing a relative spike. It's been listed in the New York Times as one of the top 10 metro areas in the United States for the last 2 weeks. So in Iowa now, is this something that people are talking about more? I mean, what's been the impact there?
Yeah, so I think I think the curves actually went up and are coming down a bit. I think a lot of it came when schools started again and the universities started again, and proper precautions weren't taken. So the University of Iowa, for example, doesn't have football games. Our neighbor over in Iowa State does. That's almost certainly going to lead to an increase in cases. We don't know for sure. It's outdoors, which actually helps prevent transmission. But these are all decisions that are made, and it's not really clear who's making the decisions, what the processes are for making them. So yeah, in Iowa, and we never have had a trough. We went from a low to moderate level, and then we're back down to a moderate level from a high level. And I don't know what's going to happen over the next few months. But again, it's because we're not really thinking about this in a way that similar to what Bill was just describing for a school opening.
And Bill, let's talk about how the U.S. stacks up against other countries. You mentioned China. I know there's been other examples, South Korea. Talk to us about countries that have done it right and what the U.S. really needs to do to get on the right track.
Well, I think there's been a very fundamental error from the beginning of how to handle this. The Chinese did it by assuming that everybody who was exposed had to be isolated because they weren't sure whether they were infected or contagious. And as long as it was a relatively small problem, and I say relatively small compared to us, it's about less than 1/20th of the number of people totally infected in China, and actually far less than that. So while it was a relatively small problem, you could do it. You could do contact tracing, and you could isolate everybody who was exposed. And that's how they brought it to close to zero. They isolated everybody who had been, like if one person was on a plane infected, everybody on the plane was isolated for 14 days. Well, we can't do that, but we can do something else. The technology is almost here to allow us to have universal testing, very quick, cheap testing. Should really cost about 50 cents, should take about 15 minutes, something you can do at home like a pregnancy test. Then you identify those people who are contagious. That's what you have to identify. We're not doing it by contact tracing. We can do it by universal testing. And then have a program, which I call assisted isolation, to let the entire household of an infected person be isolated and supported for 10 days. We could do that for 2 to 3 months, and we'd be where the Chinese are with 10 people per day infected, rather than 40,000 people per day, and months go by when nobody dies over there of this disease. So that's where we could be with the tools that we almost have in our hands today. We don't need a vaccine. We don't need a drug. We need proper testing, and I mean real testing that's fast, so you know who's contagious. You isolate those people who are contagious. It's something we can do. It's something that can be organized at a national level. And if you take the total amount of money that it would take, it's about $100 billion, which is a tiny fraction of what we've already spent to try to take care of the economic consequences of this epidemic. And I would agree with one part of our previous speaker, and I didn't agree with much of what he said, but this has been an economic disaster. And as long as the pandemic continues, it will continue to be an economic disaster. You can't solve the economic problem without solving the epidemic part of it. And to solve the epidemic, you have to contain those people when they're contagious. And the only way to find those people who are contagious is to test for them, and test for them very frequently, because they become contagious and they don't know it for a long period of time. So you've got to find those people. And once you find them, you have to make it possible for them to be isolated in a convenient, comfortable way in their household. And then we can put an end to this. And I think we can put an end to it within 3 months, like was done in China.
Well, we've just put an end to the broadcast. I want to thank all of you for joining us, and that is it for this edition of The Heat. I'm Mike Walter in Washington, D.C. Thanks so much for watching. Hello everybody, I'm Anand Naidu. If you enjoy the thoughtful, engaged discussions you see on The Heat, you may also want to subscribe to our podcast. It's appropriately titled The Heat. Twice a week we take a deep dive on world headlines, talking to experts, journalists and others. It's a fresh, focused and intimate look at the issues that matter most. Whether it's the Hong Kong riots, the latest Middle East conflict or US politics, The Heat podcast gives the clear context needed to understand both what's going on and why. And what's best, we come to you. Whether you're at home or on the go, you can find The Heat podcast just about anywhere podcasts are found. Just search The Heat CGTN. Have a listen today and subscribe. Thanks.